Welcome to the Vascular Society Twitter account at VSGBI. My name is Julian Scott and I'm the 47th President of the Vascular Society of Great Britain and Ireland, the youngest and with 2 children still at high school. In my presidential address, I sent out a call to the membership to identify those that had expertise in the field of social media. For somebody with no Facebook or Twitter account, this was a big step into the unknown and a greater one for the executive who were challenged by the concept. We were extremely lucky to receive a call from Neeraj Bhasin, who works as a consultant vascular surgeon at Huddersfield and Halifax, who has been involved in the schoolofsurgery.org project for some years. After a presentation at the meeting, we charged Neeraj with the challenge of developing our social media platform. Today is the first step in a journey towards greater engagement in 2 directions with no barriers of membership and on a global scale, expanding the reach of the Vascular Society of Great Britain and Ireland. I hope that you will all embrace the opportunities that will arise over the next few months. Our rebranding and links to Lyme have also enabled us to develop an app for use at the VS 2013 in November. It is a new method for us to disseminate information in bite-sized pieces with CME. Over the next few months, we will be doing interviews with council members to provide you with a greater insight into the workings of the Vascular Society. At the beginning of my year as president, it became apparent that we need to adapt to the changing environment and in particular the impact of financial constraints within the NHS and industry. As Winston Churchill so aptly said, to improve is to change. To be perfect is to change often. For the majority of you, the society has remained constant in its time and format. A late start on the Wednesday and an early finish on the Friday was the norm. But we, and I mean all of us, were still paying for the empty halls and charging you for the additional sessions. This year is the change, and I hope that successive presidents will adapt and change to a constantly evolving society which will respond to the ever-changing NHS. After careful consideration and discussion with the various groups, including the Venus Forum and SARS, we felt it was appropriate that we redesigned the nature and function of the meeting to improve the educational opportunities to our members, to provide greater integration with the SVN and the SVT, and provide a better format for industry. This is the 47th Vascular Society meeting, and I would like to welcome you to a new format at the meeting in Manchester Central in November of this year. This year you will have an opportunity to tweet your questions. Neeraj and Hashim will send the questions to a panel, which will then include representatives from the Rulo Club, who celebrate their 25th year. This will give you an opportunity to engage rather than battle your way to the microphones and the usual suspects. It's an early start on a Wednesday with a parallel session, one on venous disease and the other entitled Inspiring a New Generation, which has been funded by the British Heart Foundation and is supported by a wealth of talent from the UK and abroad. The meeting continues with a wound care symposium, which will be introduced by Professor Peter Vowden from Bradford, who has just received a substantial NIHR grant. There then follows the first of our 3 industry-sponsored symposia. This will be given by KCI and will focus upon the new developments in VAC technology, which are evident on all vascular wards, with an ever-increasing number of patients with severe diabetic foot disease. As a marker of our first 20 ST3s appointments in vascular surgery, I put together a programme entitled 30 Years of Vascular Surgery, which should offer advice about the various stages of your career from trainee to the end as a consultant. Following on from our National Vascular Report in the summer of this year, David Mitchell and Professor Ian Loftus will outline the debrief from HQIP, the new NVR, and the processes involved in the next report, which will come out in autumn of 2014. As a result of our increased education opportunities, we've reduced the number of oral presentations to 20, but we've increased the total number of papers to 50, all of which will be published online in the BGS, and we are very grateful for their continued support. The first 10 will be presented in the Sol Cohen Prize, followed by 7 in the BGS Prize and 3 in the Richard Wood Prize on the Thursday. We have selected 30 oral poster papers which will be given in the exhibition hall on the Wednesday evening following the trauma session. Our honoured guests and members of council will judge the papers, and we are extremely grateful for the support of Le Maitre, who have offered a generous prize for the best oral poster. We welcome all of you to attend and to support your local trainee. The last session of the day is a trauma session, where I'm very pleased to announce that Todd Rasmussen, Deputy Commander of the US Army Institute of Surgical Research, and Professor Karel Gosling from Amsterdam will be presenting their outstanding work in the field of major trauma. This should be an exciting session and one that is relevant to all of you involved in MTCs throughout the country. At 7:30, we have a drinks reception at the Town Hall with the Lord Mayor, and I will be pleased if you could join us. It's an early start on Thursday, so I would encourage you to get an early night. Mr. Mike Wyatt, your long-serving and hard-working secretary, has kindly agreed to run a breakfast symposia entitled Meet the Experts, Council's Complex Cases. This should be enlightening and informative. There then follows a 2-hour endovascular session chaired by the diminutive figure of Professor Matt Thompson. At the end of this session, we will have the first BGS lecture to be given by an outstanding and internationally recognised expert in the field of endovascular surgery, Professor Stéphane Roland from Lyon. After the coffee break, we return to the BGS Prize session and the Richard Wood Prize. This year, we are very grateful to the improved investigators who have agreed to present their results to the Society. This is the first, and we look forward to the results and the implications for the future practice and management of ruptured abdominal aortic aneurysms in the United Kingdom. After lunch, we have the second of our sponsored symposia by the NHS BT Artery Allograft Bank. This is pertinent to my year, as we first met Dominic Dodd back in 2005 in Harrogate, when Mike Horrocks was president. The Circulation Foundation will update you as to the progress throughout the year and the recent awards, including the George Davis and the Peaker Award. On a personal note, I would encourage all of you to consider a regular donation to the CF, which can be gift aided. It is important that when we meet donors, that we can show that our society is committed to the CF, and I am sure that you would agree that the CF leaflets are an important method in delivering high quality information to your patients. The CF needs your support and is keen to involve you in fundraising and ideas that will support your patients. The final session is a look into the future of vascular surgery. Improving outcomes for people with or at risk of cardiovascular disease to be given by Professor Huon Gray. Improving the quality of life for people with long-term conditions by Dr. Martin McShane. Revalidation and appraisal by Sir Peter Rubin. And finally, reshaping vascular services by Professor Matt Thompson. As usual, the Thursday will finish with the annual general meeting and the annual dinner, which will be held in the same venue at Manchester Central. I'm sure that many of you will remember the fantastic evening we had last year with the Blues Brothers and Professor Naylor. The team this year have met with the chef, have chosen some outstanding dishes, all sourced from local providers, and a band which will get you onto the dance floor, along with the usual props supplied by Jeanette and her team. Please come along and bring your team. It will be a fun evening where you'll be able to meet new and old friends. As always, I would caution against the excesses of the night, as Friday starts off at 8 o'clock and with an upper limb session which will cover all aspects ranging from imaging, lysis, surgery, medical treatment and the emerging field of hand transplantation. I promise that there will be strong coffee available at 7:45 just to get you through the first session. This is followed by a diabetic foot symposia which is opened by Bridget Turner from Diabetes UK. The focus of the symposium will be around some of the practicalities of managing these complex cases and some innovations in terms of wound care. Pfizer have kindly agreed to sponsor a symposia on hospital length of stay and readmission. Can we afford the status quo? By which time you'll be ready for a light brunch, which will set you up for the rest of the meeting. Like most of you who run a Consult the Week programme, the medical management of vascular surgical patients is an ever-increasing element of your work. For this reason, I've asked a number of cardiologists to address some of the common scenarios which you're likely to encounter in your daily practice and hopefully offer you some simple solutions. We are extremely grateful to Professor Julie Briston and the team from Aberdeen, who will then present the results of the class trial. This is truly a momentous occasion for the Vascular Society, and I look forward to the results which you'll be able to take home to your own practice. Vision is an international study based in Canada, but a new UK arm has been recruiting patients for the last 2 years. This is focused upon very early myocardial events in patients undergoing all types of surgery. I believe that this study will have a profound effect on how we manage patients undergoing vascular surgery in the future. I've then asked two of our most prolific UK professors, Andrew Bradbury and Alan Davis, to inform the membership of 2 new exciting trials which have just gained funding and will be starting in the near future. At this point, it will be the time for me to stand down as your president and to pass the chain of office on to my close friend John Beard, who I met back in Bristol in June of 1986. How time has flown by. I have lost my hair and he has grown taller and kept a full head of hair, albeit slightly greyer. We then hand over to the Royal College of Surgeons to introduce the Kim-Mont lecturer, Professor Sir Bruce Keogh. In the year of consultant-level reporting and the improvements in care of our aneurysm and carotid patients, I felt it was important to hear from the man who has effected a significant change in the attitudes and approaches to data collection and how this will impact upon patients and relatives as we continue to provide vascular care to an ever-increasing older population with increasing levels of diabetes. Finally, I would ask you to stay for the final lecture, a Hunterian lecture by Matt Bown, Senior Lecturer in Vascular Surgery at the University of Leicester. Matt is a rare breed of vascular surgeon who has an extensive knowledge of genes and abdominal aortic aneurysm. He is able to translate complex vascular biology into a subject which you'll readily understand. This, I believe, will be a truly excellent Hunterian lecture. I hope that I have given you a vision of change and one that will bring you to Manchester to be educated, stimulated, to engage in improved clinical care, to be involved in clinical trials, and to facilitate the development of our new generation of vascular trainees, many of whom will become leaders of the society in the years to come. You can register online, and early bird registration finishes on the 22nd of October 2013. So don't delay. Get organised and book now.